I feel really happy and excited, and I'm really, I don't know, I'm really grateful that I'm pretty new, so it's a very awesome feeling to get recognized so early. So my name is Alice, and I'm a graduate student in biomedical engineering, and I currently live in Richmond, Virginia, but before this I was in Atlanta. Okay, so I heard about Rare Genomics from a website, and so I was looking for various volunteer opportunities because I wanted to be able to use my skills, like more of my technical skill set, and I was really interested in learning more about the organization. So I talked to Jimmy, and it was funny because I didn't really know exactly what I wanted to do, but I wanted to kind of explore something different than what my research was on. So Rare Genomics was awesome because I got to learn more about, I'm not in genetics, but I got to learn a little bit about genetics, but I was also interested in learning about business development, and so that's exactly what role he put me on. And it was awesome because he kind of listened to what I was interested in and what I wanted to do and put me in a role that's really suitable for me. So that's how I found out about it, and it was really awesome, and I'm so glad I'm here. Okay. Let's see, favorite ice cream. I don't know, I love sweets, so really anything sweet is great. So like any ice cream, I guess I love. I'm really into, I guess right now I'm really into like the Haagen-Dazs ice cream. So maybe like the green tea one or the rum raisin, so I love all of those. I don't know, what else is there? My favorite food, I don't know. I really like anything. I love like trying. This goes for anything in general. Like trying different things, learning about different things. So it's like food, but activities and going out and meeting people. I love meeting new people. I'm really interested in. I really like music, so I play guitar and piano and I sing, and I also listen to music, but I don't know, I don't have a lot of time to do a lot of the, have a hobby, but I do like being with people and hanging out with people. So when I do have time, I read and I listen to music, so that's kind of my getaway. So there's a personal side and a professional side. So personally, I find it really fulfilling to be helping people and to be helping families, and I'm very grateful that I've never been in that type of situation, but I think everyone's experienced when, yourself or your loved one is going through some sort of illness, and sometimes, hopefully they get better, but sometimes they don't. And I think, although I don't know in my immediate family, anybody with a rare disease, but I think that this kind of experience parallels a lot of what people are feeling, anybody who's suffering from an illness. And so it's really fulfilling to be able to help those families out. So that's from a personal side. I think it's a great organization. And from a professional side, I think the way the organization is run is really fantastic and really surprisingly effective, because you see it's a nonprofit. So first of all, no one's getting paid and everyone's working outside of their normal full-time jobs. And second of all, the people that are working here it's incredible because we don't actually get to ever see each other. We're working remotely from all over the world, and the fact that we can connect and be effective and be efficient, virtually, I think is incredible. So from a professional side, it's really awesome to see that come together, and of course, because everyone's working for the same goal and for the same mission, I think that's why we're so successful. So on that side of things, and also I really like what I do because I learn something new every day, and I'm also getting to meet really awesome people who really are passionate about the work that they do, and I find that really fulfilling. So I'm pretty new, but I would say, so I'm on the business development side of things. So I'm working with the RareShare platform. So RareShare.org is a social platform for people who are affected by rare diseases. So you can be a family member, like an advocate, or you can be a patient. And so right now, we recently acquired it last year, and we're really working on kind of getting funding for the website. And so kind of what we're doing right now is just submitting a lot of grants, but there's a lot of work that goes on behind it. So we've kind of done the whole, I've been involved with like creating the budget, talking to different people, and not just on my team, but other teams in Rare Genomics to see what they need and how that could like align with our budget, and then just kind of putting out grants. And so so far we haven't gotten a grant funded yet, but I put out maybe 3, and I'm working on my 4th one now. So I believe, hopefully when that comes in, that'll be a really awesome moment. But until then, I'm really very happy about, all the other things that we've done. Because, along the way, we've actually done a lot for the website and kind of like started organizing things. And I find that's really good for, whatever we're working on. I would love so one of my biggest things was, because we're a nonprofit, and I think, and I just talked about how I think we were wonderfully together, even though, people are volunteering their time and we're far away. But I think, because we're relying on grants, what I would love to see is that RGI, so I'm with RareShare, but also RGI would be financially sustainable. So in 5 years, it would be great to have some sort of business model where we don't have to keep, or, we can ask a little bit of money from different, our corporate organizations or corporate partners. But mostly if we could be able to stand alone, because we have such a good value proposition that I think we would be able to attract people into something more sustainable, like financially sustainable. So we're not always having to convince other people that we need money and that they have to give us money, that we can come up with some sort of model so that we can be self-sustaining, and then fund those programs that we need to fund, and then hopefully get those patients sequenced and build the organization. Because I think we're international now, but I think we could really have like a very strong international presence. And I hope that in 5 years we'll be able to expand geographically and, at the same time be financially stable when we're doing so.